Dear colleagues, dear friends of ultrasound, dear participants of this workshop, WFUMB workshop for ultrasound, and welcome to this lecture about handheld ultrasound. My name is Nurnberg. I come from Germany. I worked for WFUMB and FSUM and DGUM for several years. I have no conflict of interest. I'm very happy that we can meet online. We have this online meeting and we had to cancel the WFUMB conference this year, but we have to meet in really another time, I hope next year. We are in this program of the webinar 2021, and it's an honor for me to speak together with the WFUMB faculty. My topic is, and I named it, Ultrasound Goes Home, and that is really true, I think. It's not only a specialty of the hospitals or the practice. We go home with ultrasound today. Handheld ultrasound is really an option in ambulant palliative medicine, and I like also to present you the results of the DigiLog POCUS study in Brandenburg. That is a region, the country around Berlin, the capital of Germany. I can close my face now and we go here to this. POCUS, point of care ultrasound. It's used for a long time in fast ultrasound and in the eFast protocol. That is the classical topic where we can find point of care ultrasound and mobile ultrasound. It's also used in ICUs and bedside, the floors in the hospital, but not only in the hospital. In the last time, more and more in ambulant medicine, and I like to speak about that. We use it, and it's really a good option to use it in palliative medicine. We published about that, and you can find it on my website about in the German journal and the European journal about the option of ultrasound and using in palliative medicine. I'm a gastroenterologist, and was a gastroenterologist, and I'm working in a palliative center near my hometown. That is a hospital, and close to the hospital we founded 20 years ago a hospice and a palliative center. And my experience from that time I like to give you and to report about it. That is our hospice we built in 2004, and there are 12 places for patients and guests, we say. We built in the last 20 years a palliative network in the north of Brandenburg region, the region of Old Prussia. It's in the northwest of Berlin. We have a palliative care team and an ambulant hospice service and 2 or 3 hospices. What does it mean, palliative? Palliation means it's the entity of all procedures, medical, nursing, social, psychological, in care, and of non-curable patients with a limited lifespan. And the idea is to do something against symptom complex like pain, distress, disturbance, and others, and to palliate it. The symptom control, that is the aim of palliative medicine. Palliative care, the living quality is more important than living time. And we give spiritual and psychosocial support. What is the role and the importance of ultrasound in palliative medicine? Sonography and ultrasound, that is used as a bedside diagnostic procedure, and it's a very individual personal care. We use it in aftercare of the tumor patients. We use it in ambulant medicine, like in as point of care method, and we can also use it for ultrasound guided interventions. I like to show you some examples. A lot of patients with oncological diseases, at the end, they have a lot of metastasis, and more than 50% go in a palliative situation. If we detect it with ultrasound, that is possible to detect not only the metastasis, we can, like in this situation here, you can see that is in pancreatic cancer, and more than most of the pancreatic tumor, also in our region, over the 5 years, they go in a palliative situation and they die in that time. But we want to help them to get a better life condition and a better life, and no pain and no other symptoms. Sometimes they have fluid and inside of the abdomen because of peritoneal carcinosis, and that is one of the options that we can evacuate that fluid and help them. In the last 10 years, I think the handheld ultrasound systems improved, and we have a lot of choices now. You know, that is VScan system. We work with that system. That is a butterfly system, other systems like from different companies. Sometimes they work with handheld with smartphones, or they are adapted to tablets too. They are mobile. That is most interesting, and we can store also the images there. We worked in our study with VScan systems, and the quality of the picture and of the images is better and better in the last time. And we use it also for in home care patient to make interventions. You can see it here. There's example, and to work with the system is very easy. You can learn it in workshops. Like here, we teach it in courses that are our Eurozone courses in interventional ultrasound. We taught in the years 2010 to 2020 in Berlin, and give our experience to other people to learn it. Especially the intervention and drainage of malignant effusion in the pleural room and also in abdominal room, that is very important for the patient, that we can do that at home and not in the hospital in the practice. Then it's better for the patient. But we have not only this intervention, we have a lot of ultrasound guided palliative interventions, diagnostic interventions, therapeutic interventions of the bile duct system, of the nephrostomy we have to think about, and other tumor ablation. We published about that. You can read it. Now we come to our study. That was a study, was supposed by our Ministry of Health, and we used ambulatory, the handheld pocket systems in Brandenburg as a pilot study, and that was the structure. We published in the European Journal of Ultrasound, the Ultrasound in Medicine, and that was the study design. At first we started with a workshop for the doctors, palliative doctors and GPs. Then we give them and we teach them to use the VScan systems. Then we accompanied them in their training at home and help them, and they can ask us every time that when they want to have some help. And then we come to the application phase. That we give them questionnaires to the doctors. You can't read that, but here's with some data of the patient, with information informations about the thorax and the abdomen, very easy informations and for us. And they give us also final remarks, how good was the examination and was the influence of the ultrasound examination at home to their decision for the treatment, for further treatment, for intervention, and to other. It wasn't necessary to give them in a hospital or not. The participants in our study, 9 general practitioners, 6 palliative care physicians, specialized palliative care doctors, most of them GPs, but also some anesthesiologists. And one part of the study was also done by specialized nurses. Overall, in the time and over 1 year, we get more than 400 examinations and 364 patients. And most of them were done by the GPs, but also a group more than 79 by the palliative care doctors. And the total number of examinations in palliative care doctors was 123. More than 300 was done by GPs and the palliative care doctors. What are the indications to perform the ultrasound with the handheld systems? Most often pain, dyspnea, vomiting, nausea, swollen extremities, and some others, with pain and dyspnea the most often indications and symptoms for us to use it. The palliative care doctors use most often the fast scans, and second, the liver or the kidney scans for kidney pelvis obstruction. They perform more than 180 examinations after the fast protocol, and they look for the kidneys for obstruction and also for pleural effusion. In GPs, the pathologies they diagnosed most often were pleural effusions, hydronephrosis, and ascites. In palliative care physicians, most often ascites, and then liver lesions, metastasis, and pleural effusions. And that are in our protocol and in the results, most often results of our examinations. And that is very important. What was the influence of the medical management by using the handheld ultrasound in ambulatory settings? More than 80% told us that POCUS influenced their management. Nearly 90%, 99%, they made interventions with ultrasound. And in nearly 30%, they changed the medication plan in the further care of the patient. And in the interventions, most of the interventions are paracentesis, more than 50. Here, that is overview. 30 interventions are done intermediate, and 32% were done during the ambulant visit. Here you can see an ascites in that group. We come of the patient with pain of the abdomen. We come to our conclusion. What does it mean? Handheld POCUS may improve the patient diagnostic and management in outpatients. That is very important. It can therefore relieve the limited resources of the healthcare system, not only in fair countries like in Africa or in Asia or South America, also in Europe. It's important to save money and to save resources. Handheld ultrasound guided interventions in palliative patients are really an option for that patient. It's safe for them and you can do it at home. The indications for interventions at home most often are fluid collections like ascites and pleural effusion. And that interventions at home are easy to proceed and we have rare complications. So we can say ultrasound really goes home, and not only in regions with an incomplete structure, healthcare structure, also in the modern systems like in Europe, you can use ultrasound to go home and to make interventions at home and to get information to change and to control your therapy. That was a professor of ethics and philosophy, that is Professor Mayo, and he published that ultrasound is a dialogue-based examination. Ultrasound can visualize life, and that's why we use ultrasound in touch, and we use it in communication to the persons, to our patients. And that's why it's really an example of a very close relationship between the patient and the doctor. A good physician should use an ultrasound and should do a lot for his patient, and he can do it at home, also with ultrasound. I hope we will meet next year to further lectures and for discussion. Thank you very much for your attention. Thank you. See you again next